This is just facts. This is a series of facts surrounding the topic of abortion and sepsis in the state of Texas. It's just facts with no additional personal commentary. In 2017, the percentage of women hospitalized with sepsis during their second trimester of pregnancy was 2.9%. In 2021, the percentage of women hospitalized with sepsis after a pregnancy loss in the second trimester was just under 3%. That is roughly the same as 2.9% in 2017. On June 24, 2022, the Supreme Court released the Dobbs decision, which effectively overturned Roe v. Wade, the case which had previously upheld abortion rights across the country. On August 25th, 2022, the Texas abortion trigger law went into effect. The law prohibits abortions except when a pregnant patient has a life-threatening condition. It also states that a doctor providing an illegal abortion in Texas can face up to 99 years in prison. It also says that the medical board can take away the license of a doctor found to have performed an illegal abortion. Its provisions are in Chapter 170A of the Texas Health and Safety Code. The law does not define what rises to the level of threat or death. It says it's left up to the exercise of reasonable medical judgment. Reasonable medical judgment is defined up here as a medical judgment made by a reasonably prudent physician knowledgeable about a case and treatment possibilities for the medical conditions involved. A miscarriage is defined as a pregnancy lost in the first 20 weeks, and roughly 10 to 20% of pregnancies end in miscarriage. These are the different types of miscarriages. Sepsis is the body's immune response to some sort of insult or injury or infection. It is unpredictable. It can progress rapidly. Once a patient is in septic shock, multiple organs, including the lungs, the kidney, and the liver, begin to fail, and the patient can die. Sepsis is the leading cause of death in hospitals in this country. Every year, 1.7 million adults are diagnosed with sepsis, and at least 350,000 die. There is no specific set treatment protocol for sepsis. It is just supports to try to treat the underlying infection that is usually the cause of sepsis. In 2023, the percentage of women hospitalized with sepsis in the second trimester of pregnancy was 4.9%. This increased nearly 2% from 2021. The percentage rates of sepsis that I shared with you are broken out into two categories. Those where a woman had a diagnosis of a fetal death, meaning she had sepsis and she had a fetus with no heart rate. And the second percentage represents women who were hospitalized with sepsis but did not have a fetal death. In other words, their fetus still had a heart rate. In 2017, the percentage of women who were hospitalized and diagnosed with sepsis but did not have a fetal death was 3.7%. In 2017, the percentage of women who were hospitalized and diagnosed with sepsis but did have a fetal death was 2.1%. In 2023, the percentage of women who were hospitalized and diagnosed with sepsis but did not have a fetal death was 6.9%. In 2023, the percentage of women who were hospitalized and diagnosed with sepsis but had a fetal death, the percentage was 3.1%. In 2017, the separation between these two types of patients was 1.6%. In 2023, the separation between these two types of patients was 3.8%. The percentage increase for women hospitalized and diagnosed with sepsis but did not have fetal death is disproportionately higher than those that were hospitalized and diagnosed with sepsis but had a fetal death. The Senior Counsel with Alliance Defending Freedom, a conservative Christian legal advocacy group, said, "What is and is not an abortion? What is an abortion emergency? That may need some clarification in some areas." Currently, 14 states are enforcing bans on abortion throughout pregnancy. And those were the facts surrounding abortion, sepsis, and the state of Texas. I used this ProPublica article as a framework for the facts that were provided for you today. These facts are taken from the state of Texas, the U.S. government, reputable hospitals and medical treatment centers like the Mayo Clinic and the Cleveland Clinic, and the Associated Press. Thank you.